Hiya. I just want to let you know the type of courses that I run at the practice in Garstang, where I treat patients. So I run all of these courses during the year, and these are in-house and totally practical, designed so that you can actually see me physically treating a patient. I do all of the theory that surrounds all of these types of dentures in terms of the practicalities, but I also show you exactly how I treat a patient with a patient in the chair, which I think is really, really important. There are elements of hands-on for this process too, but a lot of it is really just watching me and looking at how I work with my patients. These days are really interactive, and I just really love it when I have delegates coming here and watching what I'm doing and asking me tons of questions all through the day. Even with the patient there, you can just ask any type of question that just comes into your head, because it's so many details to do to actually make really good dentures and make really good dentures work. But at the end of the day, the whole aim of these days are to enable you to go straight back to practice and be able to make and provide better dentures for your patients. I want you to be happier with what you're doing and technically feel and enjoy providing dentures. But also, I really want you to have improved patient outcomes, less reviews with patients, less problems. It makes everything much smoother. It makes it more profitable as well in terms of what you provide. And also, it's just way more enjoyable, but more patient satisfaction. And I love it if dental technicians come on these courses too. If you come as a team, the two of you, as a clinician, technician, or CDT, that sort of thing, all together is fantastic as a whole team, because you just get so much out of these sorts of things. So I run two sort of standard complete denture courses a year, one in March and one in September here. These are 2 days. I have a patient, you can see exactly what I'm doing. I run 2 partial denture days during the year as well. That's there, number 1, and then that's there in November. These are both on Thursdays, and then the Friday after, I run an immediate denture course. This one in May, and in November I run an implant supported overdenture day 2. So these are really just so super clinical and super practical. Now, also for people who've been on my courses before, then I do run a advanced revision course as well, which is one for complete dentures. That's one in July, and I run one for partial dentures in September. Now, this also includes implant supported overdentures for partials and complete dentures too. So now, also the other thing that I really, really encourage people to do and delegates to do is to bring in cases and bring in photographs and models and things, and we can treatment plan those too. I want these days to be really practical and interactive, but I just love it, just helping people to make life-changing dentures, make dentures that look fantastic, but also are really good for the patient's mouths. But taking someone like Donna here and getting rid of all of these failing upper teeth, showing you how I do impressions. This sort of thing will be demonstrated actually closely, firsthand. See me, my body position, how I've got Claire's position, just to help you take that straight into practice so that you can make superb impressions, superb jaw registrations. This is an immediate case there to there. The immediate day is fantastic for helping get the teeth in the right place and maximising the comfort of these things too. So it's just wonderful. I love talking about tooth positions. This is Muriel with a denture, and we've used that wonderful, beautiful smile to replicate that. So that's what I'm talking about. I'm wanting the dentures, complete dentures, to the teeth to be put back where their natural teeth used to be. So taking people from their natural dentition to giving them a denture that just looks and suits them perfectly. Also, the other thing I just want to really clarify and just to help you with is partial denture design, because this is not well understood and it's really not well taught. I use the Scandinavian approach, which has been amazing in terms of helping me with my patients, and I adopted this around about 13 years ago, and from then on I only need 1.5 reviews per patient. Prior to that, with the traditional techniques, it was 5 reviews. So this has meant that I've had hundreds of hours of extra time able to allocate to a new patient. So it's saved me so much money doing the Scandinavian approach, and not only has that been tremendous for me personally, from a financial perspective, from the practice perspective, it's also benefited the patients because these are so much less iatrogenic for the teeth, because the dentures are supported by the natural teeth and they're not stripping the gums. They're much better tolerated, there's better hygiene. So the long term with these types of dentures in my practice has just been astounding. So there's just no way that I go back to my traditional approach. And at the partial denture day, I will be talking about, I want you to go away, if you come on it, I want you to be able to go away to be able to design any combination, any pattern of missing teeth, using these guides here to help you hone in and think, right, that's the right type of design for this patient. I want to use that. You can communicate with your technician, and then you can say, yep, that's what I want. I want number 9, please, for that. So we'll be talking about good prognosis and poor prognosis is in the partial denture thing. And also, the other thing is that with dental implants, I think that dentures, this is replacing those missing upper 2 to 2, and these missing upper 2 to 2. So we're talking about the upper incisors there. This is implants, this is a denture, which looks better. In my hands, a denture looks way better than implants. So we'll be talking about that, how to get great aesthetics. It's wonderful too with these people. And the implants overdenture day is just fantastic. I absolutely love, in particular, 2 implants in the mandible to support a lower denture. It is fantastic. Just using the locator attachments on some implants to support that lower denture, it is just tremendous for helping that patient chew and eat and look great and function really, really well. So I would absolutely love it if you could join me on any of these days. Just come along, and I would encourage people that have been on my courses before to come on the revision days. They're just going to be brilliant for you. The days are quite expensive to do, but they are massive value because you've got nuggets of gold all the way through the day. Thank you.